Basically, thank you for actually listening to people with a lived experience as well. I myself am a person who has a lived experience of mental illness. Basically, one of my questions would be, is now that the Medicare scheme, I believe, which I'm not 100% sure, that the records will be able to be seen by your healthcare professional? And no. Basically, looking at, say if I see a healthcare professional, for instance, that my previous records can be accessed by that healthcare professional with or without my consent. I only ever really heard news reports about it, but I've never really heard much information.
Oh, Robert, yes, no, very pertinent question, Robert. I think what you're referring to and what you would have heard about is a long-winded name, the Personally Controlled Electronic Health Record, which is something which all governments are collaborating on, the federal government from Canberra and all the different state and territory health services. And it is about when you go to see a doctor in your GP in the GP's rooms, or if you come into a hospital, each of those services will have a medical record about you and about your treatment that they've given you. And the idea of the Personally Controlled Electronic Health Record is that we find ways that we can connect those records up so that if you go to see your GP, for instance, and you say, well, actually, I did see another doctor, or I was in the hospital for some treatment, I'm not sure what drugs I'm on or whatever, if we can connect people up and you give permission, then the general practitioner, for example, can get your record. But an important part, and that's the objective, and it has huge benefits if we can do that. However, there's also the issues of patient privacy and the rules that are being developed for that national connected system are that you as the patient, it's called a personally controlled or patient-controlled electronic health record, and that's because the idea is that you as the patient can determine what is shared and what isn't shared. And so you have the choice of whether you want that information available or not.
Thank you for that. That actually did answer a large question, mainly because I actually am a service user and also a service provider. And one of my biggest areas were confidentiality. And I believe that that's pretty much answered it.
And we can provide more information about that if you want.
No worries, thank you.
Okay,
Thanks.
Thank you.